The common cold is a viral infection that primarily affects the upper respiratory tract, including the nose, throat, and sinuses. It is one of the most widespread illnesses, usually mild, and often caused by viruses like rhinoviruses. Although it is generally self-limiting, the common cold can cause discomfort and occasionally lead to more serious complications, particularly in people with weakened immune systems. Causes of the common cold. The common cold is caused by a variety of viruses, with rhinoviruses being the most common culprits. Other viruses that can cause a cold include coronaviruses, adenoviruses, respiratory syncytial virus (RSV), parainfluenza viruses. These viruses enter the body through the nose, mouth, or eyes, typically after inhaling airborne droplets from someone who is infected or by touching contaminated surfaces. Transmission. A common cold spreads easily from person to person, especially in close contact environments. Transmission occurs through airborne droplets. When an infected person coughs, sneezes, or talks, tiny droplets containing the virus can be inhaled by others. Direct contact. Touching surfaces or objects contaminated with the virus, like doorknobs, phones, or shared utensils, and then touching your face, especially your nose or mouth, can lead to infection. Close personal contact. Shaking hands, kissing, or hugging someone with a cold can spread the virus. Symptoms of the common cold typically develop 1 to 3 days after exposure to the virus and can last up to 10 days. These include runny or stuffy nose, sore throat, cough, sneezing, congestion, mild headache, mild body aches, low-grade fever, usually uncommon in adults but more common in children, fatigue. The severity of symptoms can vary depending on the person and the specific virus causing the cold. Diagnosis. The common cold is usually diagnosed based on symptoms. No specific tests are required, as the cold is a mild, self-limiting illness. However, in cases where symptoms are severe or prolonged, a healthcare provider may conduct tests to rule out other conditions like the flu, strep throat, or a bacterial infection. Treatment. There is no cure for the common cold, but treatment focuses on relieving symptoms and supporting recovery. Most people recover without medical intervention, but several self-care measures can help. Rest. Getting plenty of rest allows the body to fight off the infection. Hydration. Drinking fluids like water, herbal teas, or broths helps thin mucus and keeps the throat moist, easing discomfort. Over-the-counter medications. Pain relievers. Medications like ibuprofen or acetaminophen can help reduce fever, headaches, and body aches. Decongestants. Nasal sprays or oral decongestants can help relieve nasal congestion but should not be used for more than a few days, as they can cause rebound congestion. Cough suppressants and expectorants. These can help alleviate cough or make coughing up mucus easier. Antihistamines. These may be used to relieve the runny nose or sneezing, particularly if allergies are a factor. Saline nasal spray. This can help clear nasal passages and alleviate congestion. Honey and throat lozenges. Honey is a natural cough suppressant and can soothe the sore throat, while lozenges can provide temporary relief. When to see a doctor. In most cases, the common cold does not require medical attention. However, it's important to see a doctor if Symptoms last more than 10 days without improvement. You have a high fever over 38.5 degrees C or 101.3 degrees F that persists for more than 3 days. Symptoms suddenly worsen after initial improvement. You experience shortness of breath, wheezing, or chest pain. You develop a severe headache, sinus pain, or swollen glands. These could be signs of complications, such as a sinus infection, bronchitis, pneumonia, or a secondary bacterial infection. Preventing the common cold involves reducing the risk of exposure to viruses. Wash hands frequently with soap and water for at least 20 seconds, especially after blowing your nose, coughing, or being in public places. Use hand sanitizer containing at least 60% alcohol if soap and water are not available. Avoid touching your face, particularly your eyes, nose, and mouth, to prevent virus entry. Disinfect commonly touched surfaces, like doorknobs, keyboards, and phones, especially during cold season. Avoid close contact with sick individuals. Practice good respiratory hygiene. Cover your mouth and nose with a tissue or elbow when coughing or sneezing, and dispose of used tissues properly. Maintain a healthy immune system. Regular exercise, a balanced diet, adequate sleep, and managing stress can help strengthen your immune defenses. Complications. Although the common cold is typically mild, it can lead to complications, especially in vulnerable populations like young children, the elderly, or those with weakened immune systems. Complications include acute sinusitis. A cold can lead to sinus infections, causing pain and pressure in the face, and requiring antibiotics if caused by bacteria. Ear infections. The buildup of mucus in the ears can cause infections, especially in children. Bronchitis. Inflammation of the bronchial tubes can cause persistent coughing and wheezing. Pneumonia. In rare cases, a cold can progress to pneumonia, particularly in those with weakened immune systems or chronic lung conditions. Conclusion. The common cold is a frequent, mild illness caused by various viruses, primarily rhinoviruses. While there is no cure, symptoms can be managed with self-care and over-the-counter medications. Most people recover fully within a week or two, but it's important to watch for signs of complications, particularly in individuals at higher risk for severe illness. Prevention, such as good hygiene and avoiding contact with infected individuals, is key to reducing the spread of cold viruses.